Every single night, 50 million Americans wake up to use the bathroom. Not once, but 2, 3, sometimes 5 times. And here is what nobody is telling you at your doctor's appointment. In 80% of those cases, your bladder is completely healthy. It isn't the problem. And the pills, the supplements, the herbs you've been taking for your prostate or your bladder, they're aimed at the wrong organ entirely. It takes 5 seconds. We're working toward 1,000 subscribers, and we're building this channel on one principle. The system makes money when you stay sick, not when you get better. What I'm about to tell you, nobody in a clinic waiting room is going to say. 3 in the morning, your apartment is completely still. You finally sank into that deep, heavy sleep, the good kind. And then the signal comes. Think at first, somewhere at the edge of your awareness. You try to roll over. You try to think about something else, but the pressure builds. You throw back the covers, drop your feet onto the cold floor, and shuffle to the bathroom like a zombie. You squint against the light. You do what you came to do. You come back to bed, and sleep is gone. Your mind is running. Work, the mortgage, the kids. You lie there for an hour. You finally drift off, and it happens again. Second time tonight. You wake up in the morning shattered, heavy-headed, and you pour coffee into yourself all day just to function. I see this in the eyes of hundreds of patients who walk into my practice. And almost every one of them says the same thing. Doc, what can you do? It's just age. Everybody gets up at night. Let me be direct with you. That is a lie. It is a dangerous illusion, and it needs to be shattered right now. Getting up at night to urinate is not normal. Not at 40, not at 50, not at 70. A healthy body is built differently. At night, your brain produces a specific hormone called antidiuretic hormone, also called vasopressin. Think of it as a factory manager sending a memo to your kidneys. Stop, night shift, concentrate the urine, reduce the volume, run in economy mode. That mechanism is precisely what allows a healthy person to sleep 7 or 8 hours straight without a single interruption. When that mechanism breaks down, it is not a minor inconvenience. In medicine, the condition is called nocturia, which simply means urinating repeatedly during the night. And it is a diagnosis. If you get up once a night, that is a warning signal. If you get up twice or more, that is an alarm going off. Because every single time you wake up, your pulse jumps, your blood pressure spikes, and you interrupt the phase of deep sleep, the phase in which your brain clears out metabolic waste products, neurons repair themselves, and your heart genuinely rests. Years of losing this phase is a direct path to hypertension, depression, and accelerated brain aging. Clinical research shows that nocturia stresses the cardiovascular system faster than smoking. That is not an exaggeration. That is data from published clinical studies. Now here is the most important thing I want you to hear right now. When patients come to me with this complaint, most have already decided they know the cause. Men say, "Doctor, it's my prostate, I'm sure of it." Women say, "It's menopause, prolapse, chronic bladder infection." They've been drinking diuretic herbal teas, taking antibiotics, buying advertised supplements for urological health. They've been restricting their water intake so aggressively that their mouth goes dry by evening. They stop drinking tea after 6. They go to bed parched, and they still get up at 3 in the morning. Why? because they're fighting the symptom, not the cause. Let me explain this with a simple model. Imagine your home's fire alarm goes off in the middle of the night. What do most people do? They cover the sensor with tape so it stops making noise. The correct response is to find where the fire is. That is exactly how most people treat their nighttime bathroom trips. Your bladder is the sensor. It is simply signaling that something is happening somewhere else in the body. In 80% of cases, the bladder is perfectly healthy. It is doing exactly what it is supposed to do, emptying what gets put into it. The problem is not the reservoir. The problem is who is filling it during the night and why. And the answer to that question may genuinely shock you. The culprit is your legs and your heart. But before we get to the mechanism, I need to say something as a physician with 15 years of clinical experience. There are symptoms that should send you straight to a doctor, not to a video. Know these. First, blood in your urine without pain. Remember that combination. If there is pain in blood, it is most likely a kidney stone or acute bladder infection, miserable but not immediately life-threatening. But if you see dark red or brown urine, blood clots in the toilet bowl, and nothing hurts, that is one of the most serious early signs of bladder cancer. In men and women over 50, that finding is a direct indication for cystoscopy, a procedure where a doctor looks inside the bladder with a small camera. Do not wait. Second, bone pain combined with sudden weight loss. If your nighttime trips are accompanied by aching in your pelvis or lower back, and you have lost 10 to 20 pounds over 2 months without dieting, that pattern is a warning for, if none of those apply to you, you can breathe. You are going to be fine. But the quality of that life is worth protecting. And to do that, we need to understand exactly what malfunction is happening in your system. In urology, nighttime urinary problems divide into 3 fundamentally different types. The treatment for each is different, and what helps one type can actively make another worse. Type 1 is global polyuria. That is, producing too much urine overall. You are going frequently both day and night, and each time the volume is large. If you collected everything you produced in 24 hours, you would measure 3 to 4 liters. There are usually 2 causes. First, you are simply drinking enormous amounts of fluid, walking around all day with a water bottle. Thinking more is always better. The physics is simple. Whatever goes in must come out. Second cause is diabetes, either type 2 diabetes, where glucose pulls water with it, or central diabetes insipidus, which involves a hormone disruption in the brain. Urine in this type is usually pale, nearly odorless, and you go just as often during the day as at night. This type needs an endocrinologist and a blood sugar test. Type 2 is nocturnal polyuria, the most insidious type, and the one found in 60 to 70% of people over 50. The picture looks like this. During the day, you live completely normally. You work, you run errands, you visit the bathroom every 4 or 5 hours. Nothing hurts, nothing burns. But the moment you lie down, the nightmare begins. 3 or 4 trips per night, each time a full bladder, large volume. In the morning, you look and you genuinely cannot figure it out. You had half a glass of kefir last night. Where did 1.5 liters of fluid come from? This is classic nocturnal polyuria. Your kidneys have switched their filtration activity to nighttime hours. They run at half capacity during the day and at 200% at night. We will unpack why in detail in a moment. The critical point: if this is your type, the bladder has nothing to do with it. Treating the bladder is useless. Type 3 is a reservoir problem. Here it is the opposite. Urges are frequent, sudden, and urgent. It feels like you will not make it. You rush to the bathroom, sit down, and almost nothing comes out. A few drops. 40 minutes later, the same storm hits, and again, almost nothing. The problem here is the bladder itself. It has lost the ability to stretch to a normal capacity, or its nerve signals have become hypersensitive. The trigger fires at 50 milliliters of urine, even though the normal capacity before urgency should be 200 to 300 milliliters. This occurs with benign prostatic enlargement in men, overactive bladder in women, chronic bladder infection, or bladder and ureteral stones. So to lock that in, frequent and large volume, both day and night, global polyuria. Fine during the day, flooding at night, nocturnal polyuria. Urgent and frequent urges, but tiny output, a reservoir problem. Identified your type? Keep it in mind. Now I want to tell you about one of my patients. I will call him Anatoly. 54 years old, solid, self-sufficient man, not a complainer. Only comes to see a doctor when he is desperate. And he was desperate. He walked in with a thick folder of paperwork. Bladder ultrasound, PSA blood test. PSA is a prostate cancer marker. A stack of prescriptions. He told me right away, "Doc, it's my prostate or God forbid cancer. Do something. I'm losing my mind." He laid out his timeline. First, 1 trip a night, ignored it. Then 2, then 3. For the last 6 months, 4 or 5 times per night. Imagine that torture. You finally fall into sleep and you are yanked out of it again and again. Anatoly had done what the internet and advertisers tell you to do. Since he was running to the bathroom, his prostate must be guilty. He went to the pharmacy, bought the marketed supplements, the suppositories, the herbal blends. Then he reasoned, if I am producing so much urine, I need to drink less. He imposed a strict continence. And still, at 2 in the morning, he got up and released half a liter. At 4 in the morning, another half liter. Where was it coming from? He had not drunk a thing. When he sat in front of me with eyes red from sleep deprivation, I looked at his lab work. PSA, the prostate cancer marker, was completely normal. He had a mild first-degree benign prostate enlargement, but that degree does not produce his clinical picture. His bladder was clean, no stones. From a urological standpoint, he was nearly healthy. Yet this man was not sleeping and was suffering. So I stopped asking about how he urinated. I started asking about how he lived. Any shortness of breath? A little, I guess. When I climb to the 3rd floor, I have to stop and catch my breath. But I smoked for 20 years. I only quit a year ago. Does his ring feel tight by evening? Does the elastic of his socks leave a groove on his leg? Yes, he said. When I take my socks off, there is an actual indentation in the skin. But doesn't everyone have that? And right then, the picture clicked into place for me. I told him something that stunned him. Anatoly, throw out the prostate pills. You don't need a urologist. I'm referring you to a cardiologist and a sleep specialist. He looked at me like I had lost my mind. What does my heart have to do with it? I'm running to the bathroom, not clutching my chest. But he listened. And here is what the specialist found. The cardiologist identified early stage heart failure, hidden with no dramatic symptoms. During the day, Anatoly's heart was working at its limit. It could not fully circulate his blood volume, and fluid was pooling in his body tissues, primarily in his legs. And the sleep specialist, a doctor who diagnoses sleep disorders, found obstructive sleep apnea, brief repeated pauses in breathing during sleep. The person snores, stops, then startles with a gasp. Sleep apnea on its own disrupts the production of antidiuretic hormone and forces the kidneys to work more actively during nighttime hours. When Anatoly was taking prostate supplements, he was trying to fix a leaking faucet while a pipe had burst in the basement. Let me now walk you through the physics of what was happening in his body, because it is happening in the majority of you watching this. Picture a plastic bottle, half filled with water. When it stands upright, the water sits at the bottom. When you lay it on its side, the water distributes evenly. Your body works the same way. 16 hours a day, you are vertical standing, sitting. Gravity pulls everything downward. Blood, lymphatic fluid, the fluid between your cells, all of it toward your feet and ankles. When we are young, our blood vessels behave like strong elastic tubes. The valves inside our veins hold blood firmly and do not let it pool below. The muscles in our legs, when we walk, contract rhythmically and act as a pump, pushing blood upward against gravity. But with age, or if we lead sedentary lives, this mechanism weakens. Veins expand, valves start to leak, and the muscle pump shuts down because we are sitting at a desk or on a couch. Fluid begins to seep out through the vessel walls into the soft tissue surrounding them. In the loose connective tissue of the legs, up to 1.5 liters of water can quietly accumulate. 1.5 liters. That is 3 large mugs of tea, and you may not even notice it. The sock left a slight groove. So what? Your kidneys do not see that water. It is switched out of the bloodstream. The kidneys filter only what is circulating in the blood. Now comes the evening. Anatoly gets home from work, has a large dinner, often with something salty, a pickle, cured meat, a spoonful of mayonnaise, and sits in front of the television. From 7 to 11 at night, 4 hours, his legs are hanging down. Gravity keeps working. Fluid keeps accumulating in the tissues of his calves. His heart is moving slowly, low pulse, because he is simply sitting still. Then he turns off the television and lies down. And here is where it gets critical. His legs rise to the same level as his kidneys and his heart. Gravity no longer holds the fluid down in his legs. All that fluid, the water that collected over 12 hours in the sponge of his tissues, begins rapidly returning to the bloodstream. It is reabsorbed into the veins and rushes in a powerful wave toward the center of the body. The volume of circulating blood rises sharply. Imagine that someone injected an extra liter of fluid directly into your circulatory system within a single hour. That is not a metaphor. That is precisely what happens to your body every night when you have hidden edema in your legs. And at this moment, the conductor of this nighttime concert steps onto the stage, your heart. Specifically, a small but powerful hormone with a sophisticated name, atrial natriuretic peptide, also called ANP. Listen carefully, because this is the central mechanism of this entire discussion. When the returning fluid from the legs reaches the heart, the right atrium begins to fill and stretch beyond its normal volume. The heart recognizes that the system is overloaded, that pressure is rising. So it releases ANP into the bloodstream, a chemical telegram to the kidneys. The message is brief: dump the excess fluid immediately or I will fail. This hormone blocks aldosterone, the hormone responsible for retaining water in your body, and your kidneys shift into emergency mode. They filter the blood at an accelerated rate, expelling water and sodium to protect the heart from overload. The result is predictable. Within an hour of lying down, your bladder is full. You get up, go to the bathroom, come back. But the fluid from your legs has not finished mobilizing. The process continues. 2 hours later, full bladder again. And the cycle repeats until morning. That is why Anatoly, who had not drunk a drop of water since 6 in the evening, was running to the bathroom all night. He was quite literally drinking through his legs. His legs had stored 1.5 liters of fluid during the day, and at night, all of that fluid funneled through his kidneys. No prostate supplement, no herbal blend could stop it, because those interventions were targeting the completely wrong organ. Treating your bladder with pills when the cause is in your heart and gravity is exactly the same as taping over a fire alarm sensor. Your body is trying to save you, and you are trying to stop it. Now, how to check whether this is actually happening in you? No MRI, no complex lab work. All you need are your own hands and a few minutes of attention. Test 1. Locating hidden fluid. Sit comfortably. Expose your lower leg, the section between your knee and your ankle. Find your shin bone, that is the hard surface along the front of your lower leg that has no muscle covering it. Place the pad of your thumb against that bone, roughly 4 to 6 inches above your ankle. Press firmly and hold for 10 to 15 seconds. The pressure should be definite. Remove your thumb and run the pad of another finger across the same spot. What do you feel? If the skin immediately springs back smooth and flat, no significant edema. But if your thumb left a pit, a dent, that does not fill back in for several seconds, that you can see and feel, congratulations. You have just located a hidden reservoir of fluid. Even if your leg does not look swollen from the outside, that pit is evidence that your tissues are saturated with water. And at night, all of that water will move through your kidneys. Test 2. A simplified urine diary. Take 1 day off and do some simple measurements. Get any container with volume markings. A measuring cup will do. Record your urine output separately, daytime and nighttime, including the very first urination immediately after waking in the morning. Add the numbers. If your nighttime urine output exceeds 33% more than 1/3 of your total daily output, that is officially called nocturnal polyuria. A simple example. Over 24 hours, you produce 1,500 milliliters. If 500 milliliters or more of that came at night, this is your situation. Your kidneys have inverted their schedule because of edema or a hormonal disruption, not because of your bladder, not because of your prostate, because fluid is redistributing incorrectly through your body. If both tests come back positive, the pit on your leg stays, and at night you are producing large amounts of pale, dilute urine, we can relax. Your bladder is most likely completely fine. You do not need surgery, expensive procedures, or lifelong medication. You need to work on your circulation and your daily routine. And that is exactly what comes next. You might ask, fine, I understand about the legs and gravity, but I also eat. Can food affect this process? Absolutely, in ways that will genuinely surprise you. There are foods that act like a delayed switch on your kidneys, programming them to do most of their work at night, and you are probably eating them at dinner, sincerely believing they are harmless or even healthy. When I ask patients what they eat in the evenings, most say something like, "Doctor, I watch what I eat. No pickled herring, no salty snacks. I'm being careful." Then it turns out dinner was a sandwich with cheese and some cured sausage, or hot dogs with buckwheat, or crackers and cream cheese before bed. Write this down somewhere you will see it. Hidden salt. We have been trained to think of salt as something that comes out of a shaker, but 80% of the salt most people consume comes from processed and packaged food. Cheese, cured meats, sausages, mayonnaise, canned goods, bread. 100 grams of ordinary hard cheese contains as much sodium as an entire bag of potato chips. You do not taste that sharp saltiness. It is masked by fat and flavor compounds, but it is there. After 4, we turn the tap down, not off. Thirst is dangerous. It thickens the blood and raises clotting.